a brief history lesson of how we got to where we are today.
Well, the current system really traces back to World War II, and it started with price and wage controls. And so, in the midst of the war in 42 or 43, with wage controls, we started having industry compete for workers. And so, one of the ways they could compete with workers was they started offering health benefits to folks. So you could get health insurance through your employer. So if you were, building at Boeing an airplane and you were competing with other places, or in Detroit you were building tanks or whatever it happened to be, and they needed good employees, they couldn't pay them anymore, so they would give them health care. And so this sort of slipped into the system. Before that time, people were responsible for their own health care. And so, but this slipped into the system. And what's really sort of ironic about it, the IRS didn't really figure out that this was really an increase in pay until the 50s. And so there was a big uproar in the 50s when they wanted to start charging taxes on that benefit. And so Congress came in and said, no, you're not going to charge taxes on it. And that really developed the system. To be quite honest, it worked fairly well. People were still responsible for their health care. But when we added Medicare, Medicaid onto it in the Great Society, then this was like putting the train at full steam and going downhill. And so we've seen since the 70s that we've been on a fast track to where we are today. And so we have one bad government policy of wage and price controls leads to another bad government policy, then leads to Medicare and Medicaid. And so that's sort of where we are today. So that leads into where we are in the Tri-Cities, where we've given the hospital system a monopoly. Now, I'm not opposed to monopolies when monopolies are created by the market independently. So I'm not against monopolies that way. I am against monopolies when the state provides it. So the state of Tennessee, the state of Virginia, the federal government are all culpable in developing ballot. And so in our region, I think it's important to realize it's 1.1 million people that they cover, over 29 counties. And so we have a monopoly. And monopolies generally, not always, but generally, when they're created by the government, they cause mass inefficiencies. We have people get poor service. And so I think we're seeing those kind of systems. It's my understanding that's the largest medical monopoly in the United States. And so that's where we're at today. And I think that's why finding alternative methods. And if we'll all go back and just look at all the towns that we've lived in, the hospitals used to be run by the Presbyterians and the Methodists and the Baptists and the Seventh-day Adventists and all this kind of stuff. So that's where hospitals started. Like lots of things started, schools and orphanages all started by the church as a way to show the love of Christ through his people and trying to help their communities be a better place to live.
Is the fact that it's a monopoly the main problem, or are there other significant issues or challenges that we're dealing with?
Well, this area is a unique area. I think we're discovering that this system is not working very well. And so there were lots of promises when we put the hospital systems together that we've not seen. That's not to say that they may not come in the future, but we were hoping to get more medical research. We were hoping to get some other things in this combined system. What would have happened without COVID? I don't know. That's the big thing that's sort of messed up the system. And so in essence, we have a government supported hospital system through Medicare and Medicaid, and then we have really high insurance rates. So we get the worst of both cases. So Friedman, who a lot of this came from, thought that the best solution would be high deductibles or a high copay, or however you want to put it. So you might have a deductible of $10,000, but you have a low insurance cost, and you would cover the catastrophic stuff. And so the system we have is we all have really high deductibles, and we still have really high insurance premiums. And so when you add the Obamacare with what we've got here, we get the worst of everything.
Yeah.
So.
And we're going to get into some of those specifics a little bit later, but it's worth noting that in where we sit right now, we've got kind of national or more universal issues that relate to some of the history that you went through. And then we have a local problem as well, which relates to the monopoly, and that we have a real lack of options with care. And